Hello everyone, this is the second video of the Mastectomy Series presented by the Apprentice. In our previous video, we elaborated on the general anatomy of the female breast. Today, we are focusing on the skin manifestations of breast cancer. Breast cancer is the second most common cancer in the world. It is the most frequent cancer among women and the leading cause of cancer death in females worldwide. And it has become the most commonly diagnosed cancer type in the world. However, early stage cancer detection could reduce breast cancer death rates significantly. It's also important for you to be aware of changes in your breasts and to know the signs and symptoms of breast cancer. The warning signs of breast cancer are not the same for all women. In this video, we are gonna discuss about some cutaneous manifestations of breast cancer. These manifestations can be divided into two groups. Some prominent signs can be detected on the skin over the breast. They are poured orange or dimpling of skin, puckering and tethering, and skin nodules. Some common signs are seen around the nipple-areolar complex. They are Paget's disease or eczema, nipple retraction, and gross ulceration of nipple. Before discussing the above-mentioned signs in more detail, it's better to renew your anatomy knowledge about ligamentous support and lymphatic drainage of the female breast. The system of fascia that surrounds the corpus mammae and encases it in two layers of fat and fascia is named the superficial fascia system of the breast. It is comprised of anterior lamina fascia and posterior lamina fascia. Its anchorage to the deep fascia, which is the continuation of Scarpa's fascia of the chest at the breast's perimeter, is the circummammary ligament. The Cooper ligaments, which are specialized vertical cutaneous ligaments, travel from the posterior lamina fascia through the breast gland and anterior lamina to anchor in the skin. Some of the superficial lymphatics follow the pathway of Cooper's ligaments, while others travel along the dermis of the skin. Let's now look at the previously mentioned manifestations one by one. Peau d'orange, which is in French, is for skin of an orange. Dimpled breast skin or the orange peel appearance is sometimes caused by breast cancers, especially the type of breast cancer known as inflammatory breast cancer. In this case, the cancer cells infiltrate via superficial lymphatics. An obstruction of these lymphatics causes accumulation of fluid and edema of the skin. In addition, fibrosis of Cooper's ligaments and surrounded tissue occurs. Some parts of edematous skin is tethered by above-mentioned ligaments, the hair follicles, and the sweat glands such that it cannot swell. This leads to the orange peel appearance of skin. However, peau d'orange on the breast doesn't mean you definitely have a breast cancer, but it could be a telltale sign. It's important to see your doctor if you have peau d'orange on your breast. Puckering and tethering of skin. Tethering means attachment between structures. When palpating a lesion on the breast, clinicians will make note whether a mass appears which is relatively mobile or whether it feels anchored to something else. This word is used to describe how the tissue feels rather than how it looks. Puckering is essentially the same phenomenon. but the word is generally only used when the woman raises her arms up and a groove forms on the curve of the breast. It's also caused by tethering of the lesion to surrounding structures, restricting free motion of breast tissue focally. It mostly occurs due to infiltration and shortening of Cooper's ligaments. Skin nodules. A firm, painless nodule or a number of nodules of different sizes which are associated with a lasting rash can be a sign of skin metastasis. This can occur when cancer cells spread to the skin over the breast via blood vessels or lymphatic system. Now we are going to discuss about cutaneous manifestations of breast cancers around nipple-areolar complex. Before that, let's recall our anatomy knowledge about nipple-areolar complex. Nipple is the projection just below the center of the breast. 15 to 20 lactiferous ducts, each draining a lobe of the breast, converge in a radial direction to open individually on the tip of the nipple. Nipple is surrounded by an area of pigmented skin, the areola. Each lactiferous duct has a dilated sinus at its terminal portion in the nipple. Smooth muscle cells are present in the nipple and their contraction causes erection of the nipple. Large sebaceous glands, sweat glands, and other areolar glands are present in the skin of the areola. Many sensory nerve endings, Cooper ligaments, and an abundant lymphatic system called the subareolar or sappi plexus are present in this complex. The areolar glands form small elevations or tubercles of Montgomery, particularly when they enlarge during pregnancy. Because the skin of the nipple is continuous with the epithelium of the ducts, cancer of the ducts may spread to the nipple. Now, let's look at the previously mentioned cutaneous manifestations around nipple-areolar complex. Paget disease or eczema. Paget disease of the nipple-areolar complex is characterized by the presence of neoplastic cells in the epidermis. These cells infiltrate and proliferate in the epidermis, causing thickening of the nipple and the areolar skin. 50 to 60% of patients with Paget disease will get malignant tumor underlying breast parenchyma. Paget disease is most often associated with ductal carcinoma and less with lobular carcinoma. Early stages of Paget's disease can be presented as eczema. Possible signs and symptoms of Paget's disease of the breast include flaky or scaly skin on your nipple, crusty, oozing or hardened skin resembling eczema on the nipple, areola or both, redness, a tingling or burning sensation, straw-colored or bloody nipple discharge, a flattened or turned in or inverted nipple, a lump in the breast, or thickening of skin on the breast. But no itching of nipple in Paget's disease unlike eczema. Nipple retraction or inversion. Nipple retraction is properly applied when only a slit-like area is pulled inward. Nipple inversion applies to cases in which the entire nipple is pulled inward. Both retraction and inversion may be either congenital or acquired and either unilateral or bilateral. The differential diagnosis in a case of acquired nipple retraction or inversion includes inflammatory conditions such as duct ectasia, which is common, periductal mastitis, tuberculosis, and as well as malignancy. Central, symmetric, slit-like retraction usually indicates a benign process, whereas Inversion of the whole nipple with distortion of the areola is typically a result of malignancy. Nipple retraction can happen due to benign or malignant conditions. If nipple retraction is related to malignant conditions, it will be mainly invasive ductal cancers. Cancers in Cooper ligaments are also including to malignant condition. Gross ulceration of nipple. Underlying cancerous tumor can directly invade the skin and cause ulceration. Here, the whole breast can be ulcerated if the patient is late for the treatment. This is a rare condition which can cause massive ulceration. Hope you enjoyed our video. Put a comment in the comment section below and don't forget to like and subscribe to our channel. Thank you for watching.